We are happy to have Dr. Malcolm here. This is our first episode of podcast. We want to discuss about women's health and how AI powered our healthcare system to balance women's hormonal health. And Dr. Mom, can you help to introduce yourself?
Sure. Nice to be here. Dr. Malcolm Bohm. I'm a pharmaceutical physician. I've worked in the field of women's health for over 25 years and delighted to answer some questions.
Sure. You are very first supporter of Solunar Wellness. I'm grateful for that and want to know why did you decide to advise our company in the first place?
Yeah, it's been a pleasure, and I'm really excited about the possibility here. Having studied Western medicine all those years ago, I never really thought about Eastern medicine at all.
Mhm.
But one of the issues that you have in women's health is that there's actually really not a lot of solutions that truly work. And so when you come across something that is different but proven through millennia, you take a second look. And so as I started to learn a little bit more about traditional Chinese medicine, I really became intrigued about the possibility. And, I've learned a little bit, enough to be dangerous, but I think there's a real potential here for women to look at the hormonal disruptions that happen in various phases of their lives through a different lens and be treated more successfully because of that.
Yeah, that's great. Because, I come from a sixth generation Chinese doctor's family. I have seen patients flying from all corners of the world and just struggling with their fertility issues, hormonal imbalance symptoms. There's lacking a solution in the market for people to find the root cause and cure all the long-term issues. So right now, we have seen some solutions mask the symptoms rather than cure the root cause. And that's kind of disappointing users and make them want more knowledge and explore more options out there. And I'm also curious, what makes you passionate about helping women through hormonal transitions? I know there are many majors you can choose in the medical school. And how come you choose this career path for the long term?
Well, interestingly enough, I didn't choose women's health until I joined Pfizer Pharmaceuticals, and that was quite a long time after I qualified.
Mhm.
But I was fortunate enough to join the sildenafil program, sildenafil, aka Viagra, and I played a pretty key role in the clinical trials of Viagra in women. And we were specifically studying Viagra in women postmenopausal, either on HRT or not on HRT. And so I learned a lot about women's health and the struggles that women go through perimenopause and menopause. And that was back in the late 80s and the early 90s. So I kind of got an immersion in women's health very early because of that program. Unfortunately, it got closed down because of the erroneous Women's Health Initiative study results, but it remained an interest for me throughout. And the reason being is that, physiologically, these hormonal changes in women are guaranteed. It is going to happen to you at some stage in your life, be it menses, pregnancy, postpartum, perimenopause, or menopause. It's a guaranteed component of a woman's physiology. And yet we really don't have good solutions. And arguably, we don't necessarily fully understand all the basis for the disruptions. So that's why.
Yeah, there's a long way. You are so experienced in this field. Nowadays, what do you think is the biggest problem? Like what's broke in women's health treatment?
I wouldn't say necessarily treatments are broken. I think the education is missing. When people fail to conceive, they immediately think about IVF and the expense of that. They're not necessarily thinking about maybe there's an optimization of my body that I can do to have greater success. If you're in the postpartum phase, your hormones are bouncing back from a very, very low profile. And that can take up to 6 months. Again, education, people don't understand that. And as you go through the late 40s to the mid 50s, there is a transition known as menopause, perimenopause, and the vast majority of women don't actually know what that is. So it's not necessarily that treatment is broken. It's the system of education and awareness that needs to catch up. There are some countries around the world that have done very well. The UK is very, very far ahead of the United States. We are starting to catch up. And it's only really now in 2025 that this has become talked about. And you have the likes of Halle Berry and Oprah Winfrey. They're making this much more contemporary to talk about. The taboo has been broken. So as that happens, things will improve because more and more women will understand this is going to happen.
As we are talking about hormonal health, when I'm building Solunar Wellness, a lot of people will ask, what are hormonal health? Like, what are the symptoms covered by hormonal health imbalances? Will you explain a little more from the professional perspective?
Sure. Well, I'm going to stay with perimenopause because that's really the greatest field of interest for me. As you go from approximately 45 to 55 years of age, your ovaries start to reduce the amount of estrogen that they are producing. And that loss of estrogen affects many, many body systems. There are receptors in almost every single body system, from brain to your skin, through your guts, etc., that respond to estrogen. And as the levels of estrogen fall, there's an impact. And so there are symptoms that you feel very viscerally, like a hot flash
Okay.
or
That's the
brain
most
fog.
common symptom people know
Yeah,
about.
night sweats, disruption of sleep, putting on weight in areas that you never put on weight in before. So there are a whole lot of different impacts of the loss of your sex hormones. And estrogen is the big one, but actually progesterone and testosterone both play an important role because they are also reducing. So as a woman ages through perimenopause, there's a very significant set of consequences of losing those hormones. And the consequence there are a series of symptoms. And actually, there are 39 different documented symptoms. There are just a few that most women complain about because of the disruption that it causes and the discomfort that it causes. So estrogen is really the key to all of the symptoms that women endure.
Yeah, people might want to get more information about, for example, you talk about the sleep disturb, like how the hormonal imbalances or lacking of certain hormone will really impact that sleep issue.
Right. So progesterone, the loss of progesterone is actually one of the big reasons why there is sleep disturbance. Progesterone is actually really, really important for sleep in women. And so while your ovaries are starting to produce less estrogen, you're also losing a large amount of progesterone. And so there is a big impact on the wake sleep cycle in women as a result of that. And that's why, women who take hormone replacement therapies have to take progesterone. Progesterone for two reasons. One is to protect the uterus because if you take estrogen alone, it's dangerous for the uterus. So you need the progesterone to balance the risk of uterine cancer. But moreover, it's really to help for those symptoms. Progesterone is key for sleep.
I'm actually very surprised, like among our Solunar Wellness users, they're very early on user, only in early 30s, and they have sleep issues, like wake up every 1 hour starting from 1 a.m. And that lasted for months. And they go to the lab test, nothing shows anything like abnormal. So how is that common for women now, like to experience perimenopause? Like, what's the usual age range and how come this becomes so early?
Interesting questions. The normal age range for the onset of perimenopause is around about 45 years old. But we're definitely seeing that more women are presenting with fairly severe symptoms earlier than that. There is there's certainly some evidence that uh, estrogen disruptors in our diet and foods and liquids that we consume could be impacting certain women. But there are a number of other issues that women may be going through. For example, polycystic ovary syndrome, fibroids, of course, endometriosis, all of which actually take a very long time to get a correct diagnosis for. So it may not necessarily be a hormone disruption as a result of perimenopause. It may be something actually a little bit more serious, but it just takes a long time for those women to get the right diagnosis.
Usually, like I grew up in the my family clinic, have seen patients come here and to get diagnosis. A traditional Chinese doctor, they look at the tongue and can see the early imbalances long time before any lab test can show the result. And now last year, we have two academia published paper about tongue diagnosis can predicting over 97% accuracy on predicting diseases. So I'm also curious about like among your observation from the professional perspective, what's one symptom most women ignored and they didn't even think about go to the lab test, but actually they should really like pay close attention to.
Yeah. Well, let's talk about the tongue for a second, because it's just really, really interesting. The only time that I would think about as a physician examining somebody's tongue would be if they were presenting with some potential strep throat, right? Stick your tongue out. Let's have a look. Maybe I want to take a look at your tonsils or your adenoids. But other than that, as a physician, I was never taught to think about the tongue as a way, as a guidance system to the body. So I just really, really find that fascinating.
It's like the dashboard of the full body health in Chinese medicine.
Yeah,
It's
yeah, the
practiced for
dashboard.
over thousands of years.
Yeah,
Just very few people know that.
it's really interesting. And in some sense, it makes sense that what we eat is what we are, right? And the first sensation that you get is as a result of your tongue. So it's a very, very important organ. We take it for granted. It's swirling around in there, but it's actually very important. So the optic that you get through the tongue is really fascinating. And I think there are other parts to it, of course. There's the tongue, and then they're also looking at the facial features. And if they're in person, they're measuring the energy through the pulse and everything. So very different approach to medicine.
Later.
Big one is fatigue. Low energy, can't do what I used to do. I can't get off the sofa. That fatigue is a very early sign that something is changing. Doesn't mean something's going wrong. It just means something is changing. And, I'm getting older. This is just what happens. And of course, they talk to their friends and they're all complaining about the same thing, but nobody's actually saying, hey, you know what? Maybe there's something going on with your hormones. Yeah, the other issue that you face in this scenario is that many women will go to their doctor, their OBGYN, and the OBGYN won't recommend testing hormones because if you're still menstruating, when do you do those tests? What time of the month or day of the month do you do those tests that would give you an accurate reading that your levels are dropping? A lot of doctors won't prescribe that. Quite frustrating because you can tell. You can tell. But yeah, fatigue is really the early warning system in my mind.
Western medicine, you don't really look at patient's tongue, but Eastern wellness is totally a different system. Like look at the tongue can tell the early imbalances. And it's the same for fatigue. So in Eastern wellness, we talk about fatigue. We use a certain term as describe the people's wellness type as 气虚 and spleen deficiency. So there's certain root cause of the same symptom deep down. Also, as you mentioned, fatigue, curious about how you think the hormonal imbalances impact the skin and the hair. As you know, there are a lot of, I have seen a lot of young people, a dozen years younger than me, already have a lot of gray hair, and they think it's normal, and it's an average age, people starting to get it. How do you think about that?
Well, to go back to what I said earlier, the impact of a loss of these hormones in women hits every single body system. One of the most frustrating ones for women as they go through perimenopause is the impact on their skin. You lose collagen and you lose elastin in your skin, and you get this creepy effect. Very, very fine wrinkles start to appear, and your skin feels weaker. It doesn't have the strength. And so we turn to all of these creams and potions and lotions trying to replace collagen. We're doing it here, our crow's feet,
Go
etc.
in the collagen.
And that's one of the most, I think, impactful changes for women. They say that men age and we look better. Women age, they don't like those changes at all. And it's not just on the face, it's everywhere. So that's an important aspect. And when women do supplement with hormones or non-hormonal treatments, you can see quite a significant reversal of those skin changes. But you've got to catch it at the right time, otherwise they become irreversible.
Dr. Bohm, as we talked about different symptoms impacting women's in every stage of life, we have noticed even in the same stage of life, for example, perimenopause, women have so different symptoms. Some women experience menstrual cramp so seriously they even like pass out, go to ER and get painkillers, and then like the tolerance level is going up, even the painkillers not helping. And on the other hand, a lot of other women experience early termination of menstruation. How is that like change so rapidly, even for same group of age people?
Yeah, yeah. Well, it's an interesting question because there are actually a couple of dimensions here. So I want to go to the last part first. There are some women and ethnicities of women that will experience very severe early termination of menses or with their periods stop. African American women will actually have a greater incidence of what we call dysmenorrhea, which is when your periods are very, very long. Maybe they don't even stop, or they can be very, very painful. And, comes down to an education issue again. Women who have very long periods or very painful periods think that that's just normal for them, when in fact it isn't normal, and there's something going on. There's something underlying that. But in certain ethnicities, you do see this more often. In fact, I had a case a couple of months ago of an African American female. She was only 35 years old. She was having horrendous perimenopausal symptoms. And exactly what I talked about earlier, she had gone to her OBGYN with terrible cramps, terrible pain, terrible brain fog, waking up multiple times in the night and having daytime sweats so severe that she had to change her jeans, not just her underwear, but her jeans, really severe. And she went to her OBGYN. The OBGYN said, no, 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 we're not testing your hormones. You're far too young for that. So I asked her to challenge that. She went and had her hormones tested. Her estrogen was zero, her testosterone was zero, and her progesterone was virtually zero. So, in all women, there's not a predictability about it. Every woman is different. But in certain ethnicities, you can see earlier consequences, earlier termination of menses, and much more severe symptoms. Indian women, by the way, suffer terribly from hair loss, much more so than Caucasian women. They will also gray a lot sooner. So when you think about that, and I think, we're all exposed to lots of ethnicities. Now you can look and say, yeah, that makes sense. I've always noticed that older Indian women seem to have hair loss issues. That's because with that ethnicity, we see that kind of disruption. So it's not highly predictable what every woman is going to experience. But very, very painful periods. Whenever the body says pain, there's something wrong, and we shouldn't ignore that. But again, education issue. A lot of women will suffer through these, but actually there's something going on. They just think it's normal for them and they just put up with it.
So, in your opinion, the painful periods is not normal.
No, it's not normal. That's what we call dysmenorrhea. Dysmenorrhea. There's a disruption there. And unfortunately, for a lot of women, this comes down to one of two things: fibroids or endometriosis. And both are actually very difficult to diagnose. Endometriosis, just for the listeners, is muscle tissue that is invaded by uterine tissue. And so you get this pockets of tissue that not just in your abdomen and your uterus, it can actually happen in large areas, cause cause a great deal of pain. And these can be misdiagnosed as fibromyalgia or a whole host of things. It's actually quite difficult to diagnose, takes anywhere between 5 and 7 years. So a lot of women that are going around with painful periods or extensive abdominal pain might be misdiagnosed by physicians for quite some time. And these issues of fibroids and endometriosis are very difficult to treat. They're challenging to treat.
Mhm.
If you catch them early enough and you're smart enough as a physician to go looking for it, we can help these women. But this is an education issue for doctors
Yeah,
that we
sure.
have to help more physicians understand that these signals could in fact be something more serious.
Yeah, that's the same thing for Chinese medicine doctors. As you know, I moved from Shanghai to United States. So before I started Solunar Wellness, I accompanied one of my best friends. She has serious menstrual cramp, and we found her a Chinese doctor in the town. And she took the herbal medicine soup. She actually feel much better. But the time we went back, the doctor actually was surprised it worked out. So it shows that not every doctor were confident about their diagnosis, not about their treatment. So that's another reason I really want to bring Saluna Wellness to the States because my family has practiced over 6 generations. It shows like they treat the most difficult cases, even for people failed IVF, and they were able to balance the hormone and have babies naturally using our secret formula.
So let's talk about that for a second, because that's really interesting. You asked me earlier why I'm interested in your company. When women go through these various symptoms related to hormone disruption, you'll hear a lot of women don't want to do HRT. Their doctors don't want them to do HRT.
They
Okay, there are
complain
reasons
about
for
the
that.
side
That's fine.
effects.
The second group that they'll take HRT and it'll help them. But for the group women and their physicians that don't want to take synthetic hormones or bioidentical hormones or hormones of any kind, what do they do? And for the 30 years that I've been in women's health, I've heard the same stories. Let's try black cohosh.
What's
Let's
that?
try ashwagandha. These
Yeah, that's herbal medicine.
herbs, for some women, they actually work. For most women, they don't work. And this is part of my intrigue about using Eastern medicine approaches that you're trying to put into your solution that
Mhm.
we don't really understand in the West. We don't understand this. And yet it's been there for millennia. In your family, 268 years. In China, it's been there for thousands of years. And so, why don't we take the wisdom of that and apply it here? Because women all over the United States are suffering. They're trying everything they can get their hands on, and most of it doesn't work. The vast majority of it isn't proven. We all know the dangers of supplements. You open it up, you've got no idea what you're actually getting.
Yeah, that's very true. As I have noticed in the United States, people always praise about, oh, this is clinically proven ingredients. So for our formulation logic, that's not how it works. And that's the major reason why a certain supplement or functional medicine work for this individual, but actually bring negative effect for the other one. Because they have different root causes, and you have to use a different combination of formula. And in the formula, several ingredients, no matter they are clinically proven or not, efficient or not, they actually have impact affecting each other. So it's a very subtle balance in between the formulation, like including 6 to 8 ingredients, maybe even more. And that's something I have noticed, like in the supplement market, there can be like if make it more seriously can be harmful for certain consumers because for example there's an ingredient called danggui in Chinese. That's an ingredient can really boost the blood flow, and that if certain women their health type is like their blood stuck and can make their menstruation more smoother, but for the other women they might already have actual amount of menstruation that can bring disaster outcome for them. So that's why it need to be very cautiously, like we need to use the clinical level formulation to design the product for the supplement consumers.
Sure.
Yeah.
Yep.
So
Um, it's very interesting. I think one of the things that intrigues me about the traditional Chinese medicine approach that you just described is that there are different subtypes of health within the body, and some are dominant and some are recessive to each other.
mhm,
And if these become imbalanced, then you need to understand which is the one that needs to be given some help or which is the one that should be tamped down. And these health types are basically our organs, involvement of the liver versus the kidney, or the kidney versus the stomach, or whatever it may be. And that's where Eastern and Western medicine actually come together, because we study the systems in different ways, but they're still the same systems. I like the idea that we're using a different dashboard, as you said, through the tongue and facial features, etc., to try and understand, okay, which body systems are being involved here, and what is the approach that we need to take, and what are the supplements that are proven through thousands of years to help this subtype, as you say, the root cause. And I think it's really important that women are given the opportunity to actually understand their root cause for what they're experiencing.
I recalled you just mentioned like for certain diseases or symptoms, it's very difficult to spot on early in the current healthcare system. And why do you think that would happen? And what's the gap we can possibly close? In which way, in your opinion?
Well, one of the if I go to my physician and I want to have blood testing done for my hormones, in a male, it would be testosterone primarily. The system will pay for it. For women, they don't pay.
I didn't know this part.
They won't pay.
Wow.
So there's a cost. Then, if your physician decides with you that you should, in fact, have some hormone replacement, a 90-day supply of 100 milligrams of progesterone is $100, and that's after insurance has discounted it. If you have to take the estrogen patches, it's anywhere between $150 to $200 for 3 months supply. So, and this comes back to the inequalities that you find for women generally. If males needed a tampon, they'd be in our toilets. Women need tampons naturally. You don't find them anywhere. You have to go out and pay for that. There are systems outside of the US, national health systems where they provide this kind of support for free. We don't. The health system in the US is not favorable to helping women. And it's staggering to me that you have this aging population, aging in huge numbers, and our health systems or our health insurance companies don't have testing that's reimbursed for women. It's criminal, to be honest.
Yeah. But nowadays, actually, there are a lot of tech companies doing reimbursement for their staff to do the IVF or to do the egg freezing. So a lot of employees, they just think like it's the time to get the egg freezing. And they usually don't know like it's very low success rate and it's a long process, can be emotionally and financially draining in the end.
For sure, especially with egg freezing. What I love the concept. In fact, I met the founder of one of the largest egg freezing companies in the world a couple of years ago, and I'd never really looked into it, but the retrieval of the eggs is a surgery, painful, involves anesthesia, and that is expensive. The success rate of the ova that are retrieved, or the eggs that are retrieved, low success rate, as you said. But what most people don't understand is this is almost like a subscription. You have to pay for every single month that your eggs are remaining frozen. That's not cheap.
Yeah, the
That's not cheap.
story.
Yeah, women generally don't get a really good bargain.
So, how do you think, as some doctors will subscribe herbal formula for their patients, how do you think the current health system, like most of doctors think about these functional medicine or supplement? What are their biggest concern to give advice or suggestion to their patients on certain recommendations?
Well, let's just talk about functional medicine for a second. I mean, this is a growing field.
Mhm.
It's a growing field because there's a unmet medical need, as we put it, for a lot of patients and a lot of doctors. The solutions that are available to them don't work. And so they take a more personalized approach. I hate to use that term, but it's really true. In functional medicine, you have a much more diligent approach to understanding what is wrong with the patient and what are the right approaches to this. And functional medicine is much more open minded than just giving a prescription drug. They want to try and go back to finding the root causes and trying to find solutions for that are outside of traditional medicine.
Mhm.
The trouble that you still find, and I think we're going to have this problem until it's regulated, is your functional medicine doctor could say to you, yes, you should take X, whatever it is. The problem is, what is the source of X that you're going to purchase that you know is got the right amount of whatever it is in there? I'll tell you briefly. In the early 90s, the Berman sisters did a study of DHEA across 20 different supplements purchased off the shelf at GNC or other places. And they found that the supplements went from zero DHEA,
Mhm.
200%. All of the supplements made the same claim for the amount of DHEA that was in their supplements. But when they actually measured, it went from zero to 200%. So it's like playing poker blind. You don't know what you're getting in your hand. So you don't know.
Getting lottery.
It's a lottery.
So in like you have seen both sides of the Chinese medicine and the Western health system. What do you think there is certain parts Western medicine doctors or just the treatment can learn from the traditional Chinese part or the Eastern wellness overall?
Yeah. I think there's a different when we learn medicine, it's a memory game, right? It's a memory game. I have to learn all of these names of organs and chemistry and physics, and I have to train myself to be able to pull them all together.
Hmm.
And we're trained in a certain way. And Eastern medicine is done, I guess, in a similar way that you learn all of these different interactions and the different types of ways to look at treatment and assessment. And it just makes a lot of sense to me that we need to learn from each other. There's nothing wrong with Western medicine and there's nothing wrong with Eastern medicine, but it makes sense that if you put the two together, you might actually have a better chance of being right the first time. I'll take you back to what I was saying about endometriosis. It's a devastating disease. It's very difficult to diagnose and it's very difficult to treat. We don't know in Western medicine how to get to it earlier. Only a few of us know how to do it. I don't, but there are doctors out there that are specially trained to do it. In
Hmm.
Eastern medicine, there are doctors out there that know how to recognize this. And we need to learn from each other. So I think the crossover is really important.
And how do you think like most people misunderstand about the role of pharmaceuticals against like nature care supplements? Is there some concern it's not necessary for them to have or certain elements they actually need to look into when they try to pick the right solution for themselves?
So, I often tell people when they're developing a drug, whether they're developing a device or any kind of diagnostic or anything medical, I always say, hey, you need to understand that Joe and Mary, who work in the post office in the deep south of Alabama, they don't know what you're talking about. They have got no idea how to advocate for themselves. They have no understanding of all of the medicine that we're talking about. Now, it's not to say that people in the South are dumb. I'm just giving an example. It could be Joe and Mary in the Northeast at the post office. But the education level that the vast majority of Americans have isn't there. So they don't know what to ask, they don't know how to explain, and they don't know what is right for them or not.
They don't know what they don't know.
You don't know what you don't know. So when patients are coming to Solunar, they're coming to you because nothing has worked and they really, really want help and they're ready to try something different. And the great thing about, what you're achieving with your solution is clear. It is working.
Mhm.
The women don't understand how it's working or necessarily why it's working, but they love it because it is working.
Yeah, that's why we're building Solunar Wellness. I think like we provide one more approach for people desperately looking for a solution and want to do some active research. And how do you feel because it's a cross-culture brand, the people grow up like just immersed in Western medicine culture, how can they feel confident to give Solunar Wellness a shot? Like, is there a certain aspect where like need to give more information to people to make them feel well researched and feel comfortable to try it out?
I'll give you this answer. I'm not sure it's the right one.
Uh-huh.
But, when people think about chiropractors, they think, okay, they're going to crack my neck or crack my back and realign my skeleton, because that's what the problem is, right? And chiropractic is something that we all kind of understand, right? They're the doctors that kind of make your neck make a big bad noise. Think about acupuncture.
Mhm,
Acupuncture, most people understand that that's using needles and pushing them into the skin.
mhm.
I don't believe that most people actually understand that that's Eastern medicine.
Oh,
Okay. They just think acupuncture. It's a different way and it might work. Okay. And I've got lots of people throughout my life that have tried acupuncture and it's worked. Some people have given up smoking, some people haven't. I tried it, it didn't help. I used a different method. But the issue with that you face when you talk about traditional Chinese medicine and using the dashboard of your tongue is that it's so new to most people that there's just that level of, is this credible? Could it possibly really work? And when you think about chiropractor and you think about acupuncture, it has been road tested.
mhm,
So the challenge that we have with the traditional Chinese medicine methods and solutions is we have to try and show people it works. And the more patients that we can getting success with your approach, your solution to this, the better it is. I personally think that the diagnostic tool that you're building is the most important part of this. I really do. The solutions that you have are, of course, important after the fact, after the diagnosis. But I think that there's a real opportunity to build something big using the diagnostic approach, because more women will be able to use their cell phones, their cell phone cameras, etc. And your system will be able to tell them this is what AI is telling us about your body and what you're experiencing. And I think that is going to be the breakthrough for really democratizing to the point where we understand acupuncture is needles in the skin, don't know how it works, no idea. Or a chiropractor where they crack your neck and it works, no idea how. It sounds awful. And then you've got this new approach. And I think that's where the real opportunity lies to scale what you're doing. The solutions that you're able to provide subsequent to that diagnosis will have a greater opportunity to succeed if that diagnosis is right. And this approach, I think, is just really fascinating. It's very, very amenable. I don't have to go to the doctor
mhm.
to be able to use a diagnostic tool like yours. And if we can get the word out to more and more women that you can use this to actually observe and be diagnosed, I think that's going to be really, really exciting.
Yeah, I totally agree with you. I think we make this accessible to more women, like worldwide. It's really my dream to make the world-class doctor's diagnosis standardized and stable for every individuals. And that's another thing, as you mentioned, like the hormonal balances is really changing over the time. And then our approach, skip the lab, skip the blood and appointment, can make the real-time reflection. And the third part, besides like to keep the quality stable and to make it more real-time report, I do believe this AI tool can actually make the whole thing like clarify people's confusion. Because even now you have doctors going to, you have all the lab tests, all the numbers showing up. Probably most of the time, the patients still have no idea what's going on. And even you ask the doctor, they don't know what's the root cause. They can just explain what kind of ingredients or what kind of hormone you are lacking in, but they don't know the bottom line, what caused it, and what's the other potential disease you can have based on the body's reaction and the condition. So that's something like I'm very excited to build this system and power the platform like using the traditional Chinese medicine knowledge and AI, the technology to make all these possible.
Totally agree with you. I went for an eye test about a month ago,
Yeah.
and all of us at some point get our eyes tested, our vision tested.
Uh-huh.
And standard practice is a requirement when you're having an eye exam that the ophthalmologist will get his little light, shine it in your eye, and you have to look up.
Yeah.
And he's looking at the back, he or she is looking at the back of your eye. And the reason why is because they can determine whether or not there's a risk of diabetes or actual diabetic,
Mm.
right? So you're looking in through part of the body, in this case the eye, and it's really no different to what you're doing through analysis of the tongue. And I think actually beyond the women's health application that you're primarily working on now, I think this diagnostic tool could be the way in which we're adding so much more intelligence to understanding what's going on in somebody's body. Just like the ophthalmologist will look into your eye, we want to look into your mouth.
Yeah, I agree with you. Just like you mentioned, like fatigue is a lot of common issues for top performers. And our Solunar Wellness, our majority of customers are very like overachiever and top performers. And how do you think like Solunar Wellness can support them? What kind of symptoms they should approach, ask help from Saluna whenever they experience certain thing new or different from their daily life?
Well, it really yeah, you have to explain to me what you mean by top performer. Are we talking about athletes?
Has a very like well educated and working in tech or like entrepreneur running a business, like very busy schedule and usually already a business leader or a tech leader. So this
Mm.
kind of group is really like our major customers. And fatigue is like one, not even fatigue, all want to stay more energetic to catch up with their daily roles is the major wellness goal for them. It's rather than like losing weight or just like to look prettier, stay energetic, passionate, and focused might be their first top priority.
For sure. I mean, you're immersing yourself in that environment in the Bay Area. So I think you're seeing a lot more of that. But if I expand that more generally, we talked about fatigue, but actually there is a stamina problem.
Mm.
And as you go through hormonal disruptions, you will suffer not only from fatigue, but you will also suffer from greater muscle weakness because you're losing muscle. Okay. Your ability to sustain concentration goes down. You're also having sleep disruption. So all of these people are trying to go beyond their limits, but their limits are changing. Their limits are changing,
Mhm.
right? And so what you really need is an understanding of where am I? Where am I benchmarking now versus maybe a year ago? Or maybe in a year's time when they've built their company and they've got their next funding round or they've
Mhm.
launched their product and they're exhausted from that, but their body has changed. Their body has moved to a different level. So keeping on top of that, I think is what you're getting at is really it's not just a one-time diagnosis
Mhm.
because your body's going to change over time. So keeping it's almost like a subscription. You want to know in 6 months, have I changed again? And is there a different system or solution that I need to tweak or change? Or is there a lifestyle change that I need to do in addition to, a treatment or an intervention that I'm doing? Right?
Yeah, nowadays we are tracking everything, the sleep, the steps, the weight,
Right.
and even just like a lot of other metrics, but very few people are tracking their hormones. And I think the major reason is it's not sustainable for us to track. Like we don't want to get blood draw every week, right? And Soluna might be a different approach. People can track their hormone in a different way.
Correct. Totally agree. Totally agree. I mean, there are a number of companies out there that are bringing forward more real time
Hmm.
measurement of hormones from urine, from saliva.
Hmm.
Those technologies are definitely emerging, but yeah, we'll see what happens. They cost a lot of money. They cost a lot of money to bring to market. There's a lot of money behind them to scale them. I think, in some ways, real-time hormone monitoring is going to be great for certain segments, but it only tells you a little part of the story. I think what you're doing is trying to take in as much of that additional health data that we can collect about a patient, in addition to what we're able to see through that
Yeah.
dashboard, and put all of that together for a more complete picture.
Yeah. As a doctor, what's your message to young women? They might think, oh, I'm healthy enough. I don't feel any serious symptoms and I'm energetic. But for certain chronic disease or symptoms, they're dismissed by their doctors. And what's their next step? Like what other steps they can find themselves a more long-term solution?
Well, I think I'll answer that slightly differently.
Mm-hmm.
The understanding by every woman that her body changes over time in different ways to men, for example, that is really the critical thing that we need to understand as women. We're
Mm-hmm.
constantly changing. We start our menses and we have this cycle. And that
Mm-hmm.
is what we know. And how we experience that cycle, well,
Mm-hmm.
that's just what it is. The question really becomes, how well do they understand their body and the expectations of what's going to happen? That's really the key for me. And now with AI and ChatGPT and Gemini and all these other systems
Mm-hmm.
bringing so much knowledge to our fingertips, I think there may be a new chance that more people will inquire more deliberately about their health, not just women, but everybody. I felt a funny something today, ChatGPT, and what could this be? It's like the new Dr. Google. So I'm not sure that necessarily there's a direct answer to that question, but certainly the tools that are available to us allow all of us, including women,
Mm-hmm.
to interrogate a little bit more what might be going on. What can I expect? What should I expect?
Uh-huh.
What's normal and what isn't normal?
Among all the overwhelming information and a lot of different tools and tracking system, how will you recommend people to use a certain standard to pick whatever work best for them?
You just said it. You got to listen to your own body. You got to listen to your own body. When a patient presents to a physician, there's an exchange that happens. Patient says, I'm having this problem. And then the doctor or the nurse is going to ask a series of questions. Okay, does it happen at night? Is it worse during the day? Do you notice it smells or whatever? There's an exchange of information. Not exchange of information. We're trying to understand, okay, could it be this? Could it be this? Could it be this?
Mhm.
My immediate thought about that question is that the problem is we don't have enough people that are entering medicine. We don't have enough doctors, and doctors are burning out at a terrible rate. It's a major problem that the systems are overburdening the physicians that we have. The great thing looking forward is that the younger generation of physicians have so much automation of the tools available to them. So makes medicine a little bit more efficient. I think the biggest challenge that the younger generation of practitioners, irrespective of what they're practicing, the system, unfortunately, the health insurance and the health systems don't move as quickly as the automation of medicine for the doctor. So we can be really, really good at identifying something, but the system is still terribly slow, terribly burdened, terribly expensive. And so we need to kind of play catch up on the systems because this thing is so powerful now. But unfortunately, the healthcare system in the U.S. is pretty broken, and this is why, whether or not you agree with the new administration, they're trying very hard to disrupt the systems so that we can get closer to more efficient, effective medicine.
So for the young doctors, they need to catch up with the latest technology, and
Absolutely.
they you encourage more young people get into the medical school to close the gap of the lagging professionals. Got it. Thank you so much. Thank you for your time. And I will let you know once I added certain parts.
Okay.
Thank you. Have a good
See
one.
you later. Bye.